years, we have a real chance to solve America's healthcare crisis. The stars are aligning as it's never been seen before. The American people want a solution. American business needs a solution to stay competitive and retain their best employees. And segments of the healthcare industry, such as doctors, want a solution. And the President and the Congress have started a dialogue. Yet despite all those positive signs, we must not make the mistake of believing a solution will be at hand or that it will come easily. As a nation, we stand at a crossroads, either sweeping reform or sweeping this crisis under the rug with another Band-Aid. We have to translate the national dialogue into legislation that makes access to affordable health care coverage what it must be in a free and democratic society, a right and not a privilege. There are lots of pieces to that puzzle, and some are readily solvable more than others. In fact, I think some early victories might help instill confidence in the American people. Let me give you an example. When I graduated from medical school, I was $500 in debt after my entire medical education. Today, the average medical student is well over $100,000 in debt, and when you're underwater by that much money, you are forced to make decisions based on debt service, not on public service. Across America, from inner cities to rural communities, we are woefully short of primary doctors. And as long as new doctors have to chase high-paying jobs to pay off their debt, we're going to remain short-staffed in these underserved areas in our country. Today, I'm introducing legislation that would offer scholarships that would pay for most all of tuition for medical students in public colleges if they will apply their medical training in underserved areas when they graduate, and even exchange 1 year of tuition for 1 year of service. The American Medical Association says there are 45,000 students enrolled last year in public medical colleges, and the mean cost of tuition was $20,000 a year. For a total investment of less than $1 million per year, my legislation would provide a workforce so that every American can have access to affordable health care wherever they live. The scholarships would be accessible to a medical student who is enrolled full-time and in good academic standing at a public institution. Imagine the positive impact that we would have if we empowered new doctors to serve their country and the highest ideals of their profession instead of serving their debt load. It is important to make the financial commitment at the beginning of medical school so that students will study areas where they will be related to in primary care. Anyone who knows me knows I've long advocated a universal health care system providing a medical set of benefits for everyone. But we cannot get universal coverage or any interim step on the way to universal coverage without addressing and reducing the cost of health care education for our doctors. We could make significant impact by lowering the cost of health care workforce if my bill were accepted. But we would do something else. People who don't have the financial means to go into medical school and fear a crushing debt burden even if they qualify. By removing that mountain of debt, we could use that rock to build a foundation for a permanent solution. We can solve America's health care problem, and we can do it before the end of this year, but this is a first step that must happen. We must think about the workforce that will provide that universal access to everyone in the country. We cannot continue with the present funding of healthcare education and expect that we're going to have the people to provide the primary care, to do the wellness care, to do the prevention. They will all go into high-paid specialties to pay off their debt. This bill is a step that we must take, and it's one that we can make a step forward for all the people in this country.